Hemophilia. Hemophilia A and B are inherited bleeding disorders arising from insufficient thrombin generation to prevent bleeding that is caused by deficiency in coagulation factor 8 and 9 respectively.
So what is hemophilia? Hemophilia is a bleeding disorder, a problem with a person's blood that makes them bleed longer than a person without hemophilia. No one can catch hemophilia. It's an inherited condition you have from birth, for your whole life. It's just part of who you are, like the color of your hair or the shape of your nose. Here's how it works. Your blood travels through your body in tubes called arteries, veins, and capillaries. Normally, when there's a tear or hole in one of these, bleeding starts, and different parts of the blood go to work to plug the hole. Blood cells called platelets gather at the opening, and other blood parts called clotting factors help hold the platelets together to form a clot that stops the bleeding. When a person has hemophilia, he doesn't have enough of one of those clotting factors he needs to form a clot, and he keeps bleeding longer than he should. Each person with hemophilia is missing one of two kinds of factors. If you're missing factor 8, you have hemophilia A. If you're missing factor 9, you have hemophilia B. Either one can be mild, moderate, or severe. Without regular treatment, having hemophilia means you'll bleed longer than you should if you get cut. But you don't have to have a cut to have a bleed. Sometimes, especially when you're active, the tiny capillaries inside a person's body will bleed, causing a bruise or pain in the joints. Not dealing with those kinds of bleeds can cause a lot of problems later, including arthritis at a young age. But the good news is, there are good treatments available that can help you manage hemophilia effectively. Treatments that replace the missing factor help your blood clot more like a person who doesn't have hemophilia. These treatments, when used properly, help you keep your bleeding under control so you can live a long, healthy life and follow your dreams without hemophilia ever holding you back. To learn more about hemophilia, visit worldhemophiliaday.org.
Applications in medicine. Thrombotic conditions such as antithrombin deficiency and deficiency of protein C and S have a moderating influence on the clinical severity of the hemophilia, and this phenomenon has promoted interest in creating a relative deficiency of normal clot inhibitor to reduce the severity of hemophilia.
At the site of vessel injury, the first platelets arrive to start sealing the wound. Simultaneously, the coagulation cascade with its various coagulation factors is activated. This involves two pathways, the extrinsic and the intrinsic pathway. Extrinsic activation begins with now exposed molecules of the vessel wall, such as tissue factor, which forms a complex with factor 7. Finally leading to the activation of factor 10. This factor 10A is the point at which the extrinsic and the intrinsic pathways of the coagulation cascades meet. The intrinsic pathway consists of various coagulation factors activating each other in a chain reaction. At its end, a complex with an additional cofactor is formed. This complex now activates factor 10. Since the two pathways merge at the level of factor 10A, this factor has a pivotal role in the coagulation cascade. Further down the cascade, factor 10A in combination with 5A activates thrombin and induces the so-called thrombin burst. One molecule of factor 10A can catalyze the formation of 1,000 molecules of thrombin. These large amounts of thrombin cause the further activation of platelets and the enhanced formation of fibrin. Fibrin then forms strands, making up the mesh that stabilizes the platelet plug in an arterial clot and holds together the red blood cells in a venous clot. It can be concluded that the central role of factor 10A in the coagulation cascade makes it a viable target for therapeutic intervention in pathologically altered blood coagulation.
Pros and cons. Pros. The net hemostatic effect is less severe bleeding. Promote hemostasis by preventing inhibition of thrombin even if the absence of aid factor. Cons. Treatment is expensive. Complication of bleeding often result in greater severity of the disease, poor quality of life, and shortened lifespan.
Clot formation involves, among others, platelets and coagulation factors. The platelets are first to arrive at the scene and begin to loosely cover the injury. Thrombin enhances the activation and aggregation of platelets. On their surfaces, the coagulation factors, also activated by thrombin, accumulate. In tandem with 5A, factor 10A induces the so-called thrombin burst. Finally, thrombin converts fibrinogen into fibrin that then forms fibers, cross-linked through the action of factor 13. This stabilizes the developing clot. In patients suffering from hemophilia, the propagation phase of clotting is disrupted. As a result, they cannot generate thrombin in sufficient amounts to induce normal clotting. The molecule is a B-domain deleted recombinant factor 8. Its special feature? A purposely chosen polyethylene glycol polymer. This polyethylene glycol polymer, or PEG for short, is intended to prolong the circulatory half-life of the recombinant factor 8. In this way, reliable clotting could be restored.
Issue applied in Ecuador. The Ministry of Public Health has 16 hospitals where it provides comprehensive care to hemophilia patients, thanks to the work of multidisciplinary team of health professionals. Currently in treatment, 763 of which 585 have hemophilia A, 84 hemophilia B, 89 have Willebrand deficiency, and 5 have 13 factor deficiency.
Welcome to Moo Math and Science. In this video, I'd like to talk about hemophilia, the royal family, and an X-linked disease. Hemophilia acquired the name the royal disease due to the high number of descendants of Queen Victoria afflicted by it. The first instance of hemophilia in the British royal family occurred with the birth of Prince Leopold. Hemophilia is an X-linked recessive disorder. The blood of a hemophiliac lacks the ability to clot due to the fact that one or more of the plasma proteins required to form a clot is absent. A recessive gene is carried on the female chromosome X. Males possess an XY chromosome and females have an XX. Since females have two X chromosomes, they are more often carriers and not have the disease. If you look at a Punnett square, you can see that each child of a carrier will have a 50% chance of inheriting their mother's mutation, of being a hemophiliac son or a carrier daughter. The daughter of a male hemophiliac will always inherit his mutation, while the son cannot ever inherit it if the mother is not a carrier nor has the disease. A female will only be affected with hemophilia in the rare circumstance that she inherits a mutated X chromosomes from both a hemophiliac father and a carrier mother. No case of this inheritance is known among Queen Victoria's descendants. Because a female can be a carrier of the disease, it can spread, as was the case with the royal families. Princess Alice and Beatrice, both of whom were carriers, spread the disease to other royal families. Queen Victoria married Prince Louis and had 5 daughters, 2 of which were carriers. Her daughter Alice had a daughter Irene who was a carrier and married into the Prussian family and had 2 sons with the disease. Alice also had a 4th daughter, Alex, who spread the disease to the Romanov family with her marriage to Nicholas II. Queen Victoria's daughter Beatrice had a daughter, Victoria Eugene, who was a carrier, and married Alfonso and spread the disease to the royal house of Spain. So there we go, hemophilia, the royal family, and an X-linked disease. Thanks for watching, and Moo Moo Math uploads a new math and science video every day. Please subscribe.
In conclusion, the potential to reduce bleeding in patients with hemophilia, with or without inhibitors, and with a single subcutaneous dose could be life-changing. Better protection from bleeding achieved with a simple once-weekly, less invasive subcutaneous injection will be transformative.
Does hemophilia run in your family? Women with close family members who have hemophilia are very likely to have inherited the hemophilia gene. Until recently, it was widely believed that females don't have symptoms of hemophilia, that they are only carriers of the gene. But that belief is often incorrect. In 2010, the International Society on Thrombosis and Hemostasis found that female carriers had higher mean bleeding scores and lower clotting factor levels than other women their age. The Canadian Hemophilia Society has found that a substantial percentage of female carriers can suffer abnormal bleeding due to injury, surgery, or childbirth, even when their factor levels are in the range of people without hemophilia. They also found that 57% of carriers experienced heavy, prolonged menstrual bleeding. In the United States, the Centers for Disease Control and Prevention found that female carriers often had symptoms of abnormal bleeding, including joint bleeds that limited joint mobility as early as the preteen years. The World Federation of Hemophilia recognizes that female carriers can have bleeding symptoms similar to men with mild hemophilia. They define a symptomatic carrier as a woman whose factor levels are 40 to 60% of normal and who has some of these symptoms. While one of the most common symptoms is heavier and prolonged menstrual bleeding, any of the symptoms shown here could be a sign that you are a symptomatic carrier. If this sounds like you, what should you do? According to the World Federation of Hemophilia, you should talk to your doctor and have your factor levels checked to know if precautions need to be taken. For example, you may need to take steps to reduce your bleeding risk during pregnancy. And you might want to keep a medical alert card or bracelet on you in case of an emergency. If you know a woman who is experiencing symptoms of hemophilia, please share this information with her. To learn more, visit signsofbleeding.com to find useful information and links to other resources about carriers and women with hemophilia. All of us in the hemophilia community must work to increase awareness of women who are symptomatic carriers so they know they're not alone and can have better access to testing and treatment.